Hello and welcome back. Today's topic is all about cell specialization. So we're going to talk about stem cells, what they are, how they specialize, and the ethics behind that. So let's dive right in to what is a stem cell. Well, a stem cell is just an undifferentiated and unspecialized cell that still has the ability to divide and differentiate into different cell types. So it's like a lump of clay that you can turn into anything, but it exists within your body at any given time. So a single cell can then be sort of specialized into specific things, right? You could turn it into a neuron, which is a brain cell, an epithelial cell, which are found all over your body, but a pretty big one is like your skin cells. It just depends on which expression of gene you are actually trying to do. So you can force different gene expressions to occur to force this cell to then differentiate specifically into whatever cell type you are trying to get. So specialized cells are cells that just have activated certain genes, but not others. So in that example from the previous slide, like a neuron cell, a brain cell has specific genes that are related to the brain, related to sending messages throughout the body, because it has a specific function. So to become specialized, you are only kind of activating particular genes and not all of the genes. They can become specialized by their position in the body, right? Neuron cells are along the spinal cord in the brain. They are connected to one another via dendrites and axon tails, but we'll talk about that later. Hormones, they can become specialized by the hormones within your body or signals that are being sent from cell to cell, or chemicals that your body can produce, or even realistically, chemicals that your body is exposed to in the environment. Signals can cause some genes to be expressed and not others, so depending on what your body is signaling for or what is happening in the environment around you, certain cells can be forced into specific specializations depending on what your body needs. So stem cells, there are tons of ways that stem cells can be used. There's ongoing research still. There's always debates about the ethical aspect of stem cells, different treatments, but let's just talk about a few of these examples. So retinal cells are in your eye. They replace dead cells. Stem cells can replace the dead cells in the retina to cure diseases like glaucoma and macular degeneration, which allows for sight to be restored. Skin cells, stem cells can be differentiated into skin cells to replace damaged cells in like severe burn victims, can differentiate into stem cells to repair damage caused by spinal injuries. This can enable movement to paralyzed people in different levels of paralyzation, and then can also be used to differentiate into blood cells. This is helpful for bone marrow transplants, for cancer patients. As a result of a chemotherapy, you can become immunocompromised, meaning that your immune system isn't as strong as it was, because chemotherapy is a very aggressive treatment for cancer. And so you can use stem cells to create more bone marrow, which is helpful in the defense of the body. A particular disease that IB specifically wants you to know about, they have very particular interests in very specific aspects of topics, and you'll see it from time to time. This is in regards to cell specialization and stem cell differentiation. This is IB's main example. It is Stargardt's macular dystrophy. So this is in the eye. It's a gene mutation. So it is a genetic disorder that causes photoreceptors in the eye to degenerate, meaning that They don't work anymore. Photoreceptors are what you use to see. So this is your normal macula, and this is what it looks like when you have Stargardt's. So you can see the difference. It is kind of like almost like something is just totally missing here, and that's pretty much exactly what it is, right? You don't have those photoreceptors. But scientists have been doing experiments with mice using embryonic stem cells, which are showing some promise. Some promise. You are improving vision. Clinical trials with humans have started. So we are showing the advancements of scientists and how we can use stem cells to treat these otherwise incurable diseases, and how it is really pushing the limits of science at this point, because, as always, just because we can do something doesn't mean that we should do something, and we'll talk about the ethics in just a minute. But this is a great example of how there was an issue with this gene mutation. It's causing degeneration of vision, and how differentiating these stem cells can reverse those effects. Now, where do we even get stem cells? Well, there's a few ways we can get it, and I'm sure based on that first word, that first bullet point, you can now understand why stem cells have such an ethical debate. The most common source of stem cells is from an embryo. So if you source stem cells from an embryo, it's because they're the easiest to work with. They have almost unlimited growth. They do have a risk of becoming a tumor cell, but less chance of genetic damage. They're genetically different from whoever the receiving patient is, but with almost unlimited growth, you could pretty much differentiate them into anything, so they're very useful if you're hoping to differentiate stem cells into maybe like multiple different types of cells. However, removal of stem cells may kill the embryo, so that's a huge negative. There are also adult stem cells, so like even right now, as an adult human, I do have stem cells in my body, but they're really difficult to obtain. There's a way lower chance for growth, less chance for tumors, but less chance for growth, and it's much harder for them to be able to differentiate into whatever specific cells I'm trying to differentiate them into. They are, however, fully compatible. Like my stem cells would be fully compatible with me, right? But embryonic ones, they would be genetically different because it could be from any embryo. And then cord blood stem cells are from the umbilical cord of a baby. So they're really easily obtained because you don't have to you can wait till the baby is born to get the cord blood. They are typically compatible with the receiving patient. They also have a limited capacity to differentiate. You can only differentiate them into blood cells. So yes, it's much easier to get it. There's much less of an ethical conversation about it, but they don't differentiate super well, and it's a limited quantity. So based on this, clearly the best place to get stem cells, strictly looking at where you can get the most with the least invasive sort of, in the least invasive way, would be through the embryo, but of course the negatives are quite large. So we'll talk a little bit more about the ethics of this in a little bit, but I wanted to kind of give you these sources so that you can understand where they come from. So if we can source stem cells from those different places, how do we then use them? Right, so we talked about that they can be derived from embryos or the placenta, umbilical cord. Right, we just talked about where they can get them, but we just use them to replace damaged or diseased cells with healthy, functioning ones. It's been basically the goal of scientists for many, many years to help improve quality of life, and that would be by fixing diseases, curing diseases, finding ways to make life easier if you do have a genetic disorder. And so using these stem cells, there's a process. So first you have to trigger the differentiation into whatever the cell type that you want it to be. So you use a biochemical solution, you force the cells to differentiate, and then you implant the cells surgically into the patient's own tissue. You have to suppress the host's immune system because the host's immune system sees these new cells and they're like, whoa, 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 you do not belong in my body. And so you have to suppress the immune system of the host in order for the new cells to have a chance to actually kind of become a part of the host. It does take a little bit because your body is very good at defending itself, but you don't want them to kill all of these stem cells because they're not recognized as their own. And so you just carefully monitor the new cells. You want to make sure that they're integrating properly and that they don't become cancerous. You do not want a tumor to form, of course. And so it's a lot of monitoring until the integration is fully completed. Now, I mentioned this a few times, the ethics of stem cell use. Now I'm going to give you some really clear arguments for and against the use of stem cells. Now, this is a lot. I do expect you to know and be able to argue both for and against the stem cell use. While I do care about your opinion, I kind of don't. I need you to be able to defend either side regardless of your personal opinion, because this is a science class, so we're going to focus on the science of it. Yes, I understand that this is ethics, but I need you to kind of remove your own personal bias from this and be able to argue on either side depending on maybe a test question or depending on what specifically is being asked of you. Okay, so arguments for stem cell use. Well, the biggest one is improving health and the quality of life of patients. Like I said, that's been a goal of scientists for many years now. Another argument is the early stage embryos haven't developed essential features of human life yet. This is like the argument of at what point do you consider an embryo living? Early stage embryos lack a nervous system. That's one of the last things to fully form, so they don't feel anything. So if you were to go in and remove cells, they're not feeling pain for that. And there are many embryos produced by IVF, in vitro fertilization, every year that are never implanted, so they're not going to become an embryo. Well, they're not going to become a fetus, so they just sort of exist, but they're not being used for anything. So that's an argument for using the stem cells from those IVF embryos. Now, arguments against stem cell use, there are arguments that an embryo is a human life even at the earliest stage, and if an embryo dies due to this procedure, it is considered immoral to some people. Another argument against stem cell use is the fact that they can continue to divide, and by continuing to divide, they may develop into cancerous cells, and cancer is an extremely volatile disease. It could be any type of cancer that it could develop into, and so that is a large argument against stem cell use. Throughout in vitro fertilizations, women are paid for supplying eggs. You can donate eggs, be an egg donor, and you can get paid for doing this. And so at what point does that actually is that actually considered exploitation versus going through IVF because infertility is an issue? So that's like a where do we draw the line type question. And then finally, with additional costs and efforts, alternative technologies may fulfill a similar role. There's nuclear reprogramming of differentiated cell lines that is like kind of in the works, like kind of being talked about. So as we continue to learn about different methods of science, as we continue to explore avenues that currently are not fully explored, will we find alternative routes to differentiate cells that do not include the use of a human embryo. So, arguments for, arguments against. There are people that fall in the middle, there are people that fall on either side. I need you to be able to argue both ways and be able to remove personal bias from your arguments. Because I promise you that we're going to have a debate about this, and I will probably just pick your sides for you. So be comfortable being able to argue either way. All right, great job, and I will see you in class.